Hey Savvy Social Workers, this series is going to be comprised of the most common diagnoses and medications on the ASWB exam, so be sure to stay tuned for the accompanying videos. Today's chat is going to be on anxiety disorders. So let's start with generalized anxiety disorder. This is excessive worry about things such as family, health, or money. The diagnostic criteria for generalized anxiety disorder is that it has to be occurring more days than not for at least 6 months. One thing I want to point out when we are looking at these diagnoses is to pay attention to the frequency and duration, because that matters in when you're diagnosing a client with a particular disorder. Okay, so some signs of generalized anxiety disorder is difficult to control the worry, fatigue, difficulty concentrating, irritability, muscle tension, and it causes significant distress or impairment in important areas of daily life or normal functioning. Next up is social anxiety, which is the fear of social situations. The onset is usually between the ages of 18 and 15 years old. Remember, that is just the onset. Adults older can also experience social anxiety, but this is usually when it starts during those adolescent years. Some signs of social anxiety is avoid asking people for help, avoiding spaces where you can't easily hide, not showing your true self, feeling anxious and fearful in social situations, making excuses to skip events, and being extremely aware of how to behave. So on the exam, if they give you a scenario with any of these signs, then this would most likely point to a person having social anxiety. Keep in mind that the onset is during adolescence and is also more common during the adolescent period as well. Separation anxiety, which is the fear of separating from people you feel a strong attachment to. So the diagnostic criteria is that it has to be persistent, lasting 4 weeks in children and adolescents, and typically 6 months in adults. So in the stem of an exam question, if they're asking you something in regard to separation anxiety, pay attention to whether or not first it's a child or adolescent versus if it's an adult, because here the duration matters. For an adult, they will have to be experiencing these symptoms that are listed for at least 6 months. In children and adolescents, it has to be for about a month, okay? So in children, some of the signs of separation anxiety is clinginess, being unable to sleep alone, so they're still sleeping with their parents, worrying about their parents being harmed or killed, so they don't like to let them out their sights, and they may even resist going to school. So parents that have a hard time getting their children to go to school, stay at school, or even when they drop them off, it's a big tantrum. These are signs of separation anxiety in children. It is also important to note that this is normal behavior between the ages of 8 and 15 months. So on the exam, pay attention to the age, because if they're giving you some of these symptoms and they tell you that the child is, between 8 and 15 months, understand that that is normal behavior and would not be considered separation anxiety. Now in adults, the fear of being alone, difficulty separating from adult children or children in general, or their partner, and also the fear of the loved ones being harmed or killed or anything when they're out of their sight. So this would usually lead to having to know where your children and your partner is at all times. These are signs of separation anxiety in adults, and remember that it has to typically have been going on for at least 6 months. Next up is obsessive compulsive disorder, or OCD. This is where intrusive thoughts, impulses, or even images create a high degree of emotional distress. So one of the diagnostic criteria, or one of the main diagnostic criteria, is a person feels the need to perform some type of ritual that interferes with their normal functioning. Okay, so remember that it interferes with normal functioning. So you have to know the difference between obsessions and compulsions. Obsessions are recurrent or persistent thoughts, impulses, or images that are intrusive and cause marked anxiety or distress. So this is more of the mental aspect of it, the obsession. Compulsion is more of the behavioral part of it. It is repetitive behaviors or mental acts that the person feels driven to perform in response to an obsession. So this could be cleaning and over cleaning, counting, arranging, going back and forth, doing the same things. It's repetitive behaviors or repetitive mental acts. So remember, obsessions is more of the thought and impulses and images, whereas the compulsions is the actual mental and physical behaviors. Panic disorder. A panic attack is an abrupt surge of intense fear or discomfort that reaches a peak within minutes. The diagnostic criteria is that these attacks must be recurrent and unanticipated by the patient, okay? So it's one of those things that the person just doesn't see coming. One of the most effective ways to treat panic attacks is with DBT. So this is likely to be something that they also present to you on the exam. So know the most effective treatment for it, and also be sure that you know, in order for it to be considered a disorder, because a person can have a panic attack, but it's not considered a disorder until it becomes recurrent and unanticipated. So if a person is like, oh, I feel a panic attack coming on, then that means that they are anticipating it. So it's not really going to be diagnosed as panic disorder. The disorder is pretty much beyond your control or beyond your knowledge at that time. And lastly, we have agoraphobia, which is people who have a disproportionate fear of public places, often perceiving such environments as too open, crowded, or dangerous. The symptoms must be recorded for at least 6 months for it to be considered a diagnosis. Okay, so remember, agoraphobia has to be going on for about 6 months. CBT, and depending on the extremity of it, and DBT are usually the most common treatments for agoraphobia. Also exposure therapy. And lastly, we are going to talk about the medications that are prescribed for these anxiety disorder, which are referred to as anxiolytic medications or anti-anxiety medications. Okay, and so the most common ones are the benzodiazepines, which I like to refer to as benzos, and they usually end in am. And so those medications are the most common are Xanax, Klonopin, Valium, and Ativan. So of course, in my Savvy program, I always stress that you must know both the generic brand as well as the name brand. So know that Xanax is alprazolam, okay? And I could be saying a little off, but y'all see it. And also Klonopin is clonazepam. So I just think of both of the clon and clon. So I remember those. That one is pretty easy. And then Valium and diazepam. So I think of Val and Diana. Like, that's just the way I remember those two. Val and Diana is how I remember that Valium is diazepam. Ativan and lorazepam. I don't really have any way to remember that. Xanax is pretty common, so just remember alprazolam and Xanax. And then also there's Buspar, which is a mild anxiety medication. It is not a benzo, and the other name for that is buspirone. There is a little acronym that I came up with for the benzos. It's called KVAX for anxiety, and it just helps me to remember these right here, the actual brand names. So, and that's for the benzos. That's not including Buspar. So KVAX is actually not in the order that's here, but if you think of KVAX, Klonopin, Valium, Ativan, and Xanax. Okay, so remember that these are the medications that are prescribed for anxiety disorder as well as panic disorders. Okay. Benzos, what you should know about these medications, the benzos, is that they tend to work rather quickly and can be habit forming. So they are better for short-term use. So these are kind of easy to get addicted to. It's also the ones that you build up a tolerance to, and then you have to take more as time goes on. Some of the side effects for benzos, which you may need to know for the exam, is fatigue, nausea, and GI discomfort, which I know is a big one, especially the fatigue and the GI discomfort. So again, know the most common medications that are prescribed for anxiety disorders. Also know a few of the side effects, and just understand that they work rather fast, so they can be habit forming. So if someone in a STEM is wanting something, or they're referring to needing some anxiety medicine that is not a benzo and something that's mild and not addictive, then you would want to recommend Buspar or Buspirone. Okay, so that's it for this review. I wanted to try to keep it short and sweet and concise and right to the point. Please save this video for reference, like it, share it. If you have any additional comments, any way that you use to remember the medications or anything about the diagnosis, please share below in the comments, because each one reach one, we can all teach one. So that would be very helpful. Again, this was just a quick reference. I will be continuing the series on the other most common diagnoses, as well as the medications that are prescribed for them, in hopes just to give you a visual of how to understand, as well as a better way to retain this information while you are studying and preparing for the ASWB exam. As always, thank you for being here. I appreciate it. Please like, share, comment, subscribe if you haven't. This keeps the channel going and allow me to be able to continue to post free content on a regular basis. Thank y'all for being here. Let's go get them passes the savvy way.